There's only one person that's going to get you well, and that's you. There just aren't enough practitioners like yourself and myself to go around. And it's more than that, because the regimes we're asking people to do are difficult. So they have to understand why they're doing it, and then they have to manage themselves from day to day, observe their own symptoms, document, think about what's making the difference, what's making them better, what's making them worse, and fine-tune their regimes accordingly.
Dr. Myhill, I would love to hear about your cliff theory. I think it's so brilliant on how you explain to chronically fatigued patients how to avoid pitfalls and falling backwards.
Well, the cliff theory comes some way down the line, but we can certainly start with that. And I mean, the cliff theory doesn't just apply to chronic fatigue syndrome patients, it applies to all of us. Because the point is, we don't get sick in a linear way. Things happen, the biochemistry goes down, we become ill, and we push on and we push on and we push on. And then we have what I call the last straw that breaks the camel's back, and that's when you drop off the cliff and you crash down onto the beach, if you like. And for many people with fatigue syndromes, they have predisposing factors, which might be food allergy, poor diet, micronutrient deficiency, toxic stress, or whatever, and they struggle on and they struggle on and they struggle on, and then they get the viral infection, which pushes, and that as they get closer and closer to the edge of the cliff, and the viral infection knocks them off the cliff, and they're back down, on the beach again, where life is much harder. And the point is, to get back up that cliff is very hard work. It's a long climb back up that difficult cliff before you can start to feel well. So what I say to everybody, not just my chronic fatigue syndrome patients, is don't live life on the edge. If you're living life on the edge constantly, then the slightest stress, which might be a bereavement, it might be a house move or a job or a loss of a job, it might be a viral infection, you're living life on the edge, and then you risk crashing when that last stress comes along. And life is full of stresses. Life does not come to us in nice, easily recognizable, predictable packages with which we can deal with. It comes in a series of crises that we have to deal with. So at base load, at base camp, if you like, what I'm saying to people is don't live your life on the edge. Live your life away from the edge of the cliff, so that when those problems arise, you have the reserves to rise to the occasion, deal with the problem, and then stay up high. But and it really is as simple as that. And it's not a difficult analogy, and it certainly applies to my chronic fatigue syndrome patients, because they don't have the energy to get stuff done. Now, I do see it's very difficult for them, because you need energy to earn a living, you need energy to prepare food and exist, and spending energy is having fun. If you overdo things too much, you live life on the edge and you risk a major relapse. Now, what makes chronic fatigue syndrome different from normal fatigue? Because guess what? At the end of today, I will be tired, I'll have a good night's sleep, and I'll be as right as rain tomorrow. What tells you that you're living life on the edge, that you're getting close to that cliff, is the symptom of delayed fatigue. Because what happens in chronic fatigue syndrome and ME is if you overdo things and you push yourself too much, you suffer the next day, and maybe the day after that, and maybe the day after that. It's called post-exertional malaise. It's a delayed fatigue. So that is the cardinal symptom to look for. And there's another clue here that gives us a clue if you're living life on the edge, which is if you rely on addiction to get things done. So if somebody can't cope unless they're drinking coffee all day long, if they can't switch off at night without a large dollop of alcohol, if they can't function because they need cigarettes regularly, if you're having sugar constantly, and this is one of my biggest bugbears, sugar is an addiction. So if you are using addiction to keep going, then you are starting to live life on the edge, and you risk tipping over when the big stress comes on. In fact, I don't know if you're aware, I produced a book recently just called The Energy Equation. Now, it's a very simple read, and my chronic fatigue syndrome patients asked me to write something simple that they could give to their friends and their relatives and their neighbours to explain what was going on. An easy read, anybody can read it in an evening. It's not difficult, but it just details the clinical picture of what it feels like, but more importantly, how you know when you're getting close to it, because the best treatment for chronic fatigue syndrome and ME is not to get it in the first place. And if you start seeing the symptoms we just discussed, or using addiction or getting delayed the fatigue, then you're starting to get into trouble.
Yes, definitely. I'm so glad you've produced that book and created that book, because it's so difficult in family dynamics for people to understand what's going on with the patient, and to understand, a lot of times the patient really needs to rest. Maybe they've gotten their things done to work on their, limbic system. They've gotten their food done, and then they really need to rest. They need to not be doing dishes and wasting energy.
And there's another very important book put here about the energy equation, because actually we should all be doing what I'm asking my chronic fatigue syndrome patients to do, because that'll give the normal person more energy. Now, being tired all the time, there's even an acronym for it, TATT. Being tired all the time is the commonest complaint that general practitioners are asked to deal with. But people don't go to their GPs so much with that anymore, because they know they don't have any answers for it. Now, we could all use more energy. Energy is like money. It's great fun spending it. It's jolly hard, work earning it. But any normal person reading the energy equation and understanding the mechanisms of energy delivery, and then putting in place all the interventions that I'm asking my chronic fatigue syndrome patients to do, they can improve their lives, because they will have more energy. They'll have more energy to do things physically. They will have more energy to do things mentally. And the athletes put in place those interventions, they will improve their athletic performance. So the point here is there's a whole spectrum of fatigability, from people in bed to top class athletes who want to improve their performance. And you can move everybody up the energy curve by putting in place these simple things. And the only way to find out is to actually do it yourself. And I'm no paragon of virtue, but I do all these things, and I like to be able to lead my patients by example. And I'm quite sure that you do the same thing, Mary, and so should all effective therapists. I saw a thing on the telly the other day. A new diabetic clinic was being set up, and they homed in on the main diabetic consultant, who was a sphere. He was huge. What chance do those poor patients have if that guy himself, can't put in place the simple nutritional regimes that are necessary to reverse diabetes? Because treating diabetes is easy.
So easy. It's the easiest of the easy. Yes, no, that doesn't bode well for that clinic at all. I think we should always be looking at the health of the healthcare practitioner. Yes,
absolutely. And and if that person themselves doesn't look pretty healthy, then what hope for the poor patient?
Right. Right. Exactly. No, I think you're right about this energy thing and about managing energy and also rest. I stumbled on something when I was healing where I think most people that get these chronic fatigue conditions don't have the right personality for it. Usually you're not homebodies. You don't want to stay home reading a book, watching a movie. You want to be out adventuring. And that's why we often get burnt out. And often it takes quite a bit of character development, right? To get to the place, or humbleness, to get to the place where it's like, okay, I'm going to rest, even though I feel like I could do more. As I started to go into remission, I had this practice where every single Sunday I would have a full rest day. So I would do my morning routine, which was my meditation, my gratitude journal, the things that would make me healthy. And then I would only eat leftovers. So I wouldn't be cooking. I wouldn't be doing dishes. I wouldn't take a shower. And I would fully rest, no socials. And I noticed that as long as I had that day, I was getting more and more done during the week. It was really incredible. And so I kept that for a couple of years after going into remission, because it kept me very healthy. I wasn't getting colds or flus. I had tons of energy during the week. I think there's really something to that, to having organized rest so that you don't burn yourselves out.
I agree. That's a very, very good idea. And I'll tell you one way where you may be able to enhance that.
Mm-hmm. Oh, I'd love to hear.
And that's to fast as well, because fasting has many therapeutic benefits. One of the major ones is it switches on autophagy, self-eating. And that happens after 16 hours of fasting. So if you did a 24-hour fast, you then have 8 hours autophagy. And autophagy is like the body doing a spring cleaning. It's cleaning out all those old senescent cells that really shouldn't be there. And it's probably cleaning out cancer cells too. Because the fact of the matter is we are producing cancer cells all the time. I mean, as one fact is every second, just radiation from the outside world produces about 10,000 DNA mutations. Wow. And we have mechanisms for healing and repair that. We have a little molecule called DNA repair, and it spends its whole life going up and down DNA, spotting, finding out the breaks and repairing them. But if those, obviously, if we have too many lesions, for example, if somebody is a smoker or a heavy drinker, then the immune system can't catch up. But autophagy will also be part of this spring cleaning mechanism. And not only will it mop up all those old senescent cells that need mopping up, it will also kill those early cancer cells that are starting to escape and starting to grow. Because cancers take years to develop. They start off with 1 cell, and then 2 cells, and then 4 cells, and they very, very, very slowly grow. And if you can fast once a week, you greatly reduce the incidence of cancer throughout the world, overnight. In fact, there's a wonderful doctor in America called, that's not Thomas Cowan, his name is coming to my head in a moment, who recommends that we should all do a week of fasting once a year for this very reason. He reckons we would substantially reduce the risk of cancer, very quickly by that simple intervention. And again, I know this is a paleo discussion. We need to stick to paleo issues, but
we don't. We can talk about it.
Okay. Well, did primitive man have 3 meals a day? No. Did primitive man fast? Yeah, he jolly well did when he got hungry. And the interesting thing about fasting is not only do you improve yourself physically, you improve yourself mentally, markedly.
Yes.
Mental sharpness. And that makes them more effective hunters, more effective socializers. And we all know many religious ceremonies are preceded by a window of time of fasting because it elevates the mind into higher spheres and allows us to think about and appreciate the importance of higher mental issues, not just the humdrum business of staying alive.
Yes. Yes, I will tell you, in all the tribes that I go and visit and stay with, no one is eating frequently. It's 1 to 2 meals a day. They go very long periods of time without even water. And I've been really fascinated by the hydration aspect because we'll be in equatorial Africa, 100 degrees, sweating, and hiking all day in the hot sun. They don't need water. It's actually incredible. And I find that really interesting in light of, those with chronic fatigue syndrome have such deregulated vasopressin and electrolytes and all of that kind of thing. But yeah, I find fasting very effective for giving the body a break so it can regenerate its tissue. And for me personally, I think it's been my favorite thing I've brought in because I feel so good. It's like the feel-good chemicals get released in droves. I get more work done. I feel proud of myself. I'm more disciplined. The mental aspect that you brought up, I think is nothing to hide away because a lot of hero stories, they don't come from the situation. They come from the character in the situation. You can have 2 people in equally bad illnesses, and one person will come out, and it's usually the internal, right? It's that mental game that they play or cultivate or create. I was just watching a video I like to collect stories of people who have survived terrible things because I find them so interesting. Like, what were they doing to get through this and that kind of thing. And there's a woman in Australia who was running a super marathon and got caught in a forest fire and lost 70% of her tissue, not just her skin. And it's now 10 years later, but she is amazing. She was making jokes after it. She has now done many, many marathons. She's hiked all these mountains. She's traveled the world since it. And you can tell, had she gone in and been very, just the victim mindset, just very sad for herself. Yes. She wouldn't have recovered. In fact, no doctor thought she would recover from that.
Absolutely.
Yeah.
But just a little thing you need to have for people listening in. Fasting is easy, it's great, but you have to be keto adapted for it to be easy and effective. And many people listening may well be running their lives on sugar and carbohydrates, and then fasting is awful. They feel terrible, they feel hypoglycemic, they're toxic, they're poison, blah, blah, blah. So do be mindful. Don't just listen, anybody listening, don't suddenly just go and stop eating. Get keto adapted first, and then it's easy.
Yes, definitely agree with that. It's so hard when your blood sugar is swinging up and down and can even go too low. But yeah, I think fasting is a wonderful tool that people can use, and it also helps to reduce histamine levels and lactic acid levels and things that are often an issue with chronic fatigue.
It's a very good anti-inflammatory intervention, as indeed is the ketogenic diet.
So when you're working with chronic fatigue patients, what is your recommendation for fasting once they've become ketogenic? Do you have them do a once a week fast? Do you have them do the daily intermittent?
I don't start off with that.
Right.
I mean, the problem with any intervention is in the short term, you can make people worse.
Yes.
And many patients with chronic fatigue anemia who are seriously ill cannot afford to be made much worse. So you have to go into these interventions gradually. And the roadmap for everybody to get well is exactly the same. First of all, we have to improve energy delivery mechanisms, so they've got more energy to do things. And then we have to, as I call it, plug the holes in the energy bucket. So the obvious hole in the energy bucket is the immunological hole, which may be there because that person is fighting chronic infection. And guess what? You need a lot of energy to fight chronic infection. And if you're using all that energy fighting chronic infection, you haven't got any left to have a life with. So identify where it might be an allergic hole in the energy bucket. It might be an emotional hole in that energy bucket. So, the overall strategy is say, first of all, get the energy delivery mechanism better, and then identify the holes. But of course, sometimes we don't have the freedoms to do all those things in a very logical order, and we have to cherry pick the easy things. But let's start with the overall strategy, because there's only one person that's going to get you well, and that's you. There just aren't enough practitioners like yourself and myself to go around. And it's more than that, because the regimes we're asking people to do are difficult. So they have to understand why they're doing it, and then they have to manage themselves from day to day, observe their own symptoms, document, think about what's making the difference, what's making them better, what's making them worse, and fine-tune their regimes accordingly. So it's a little bit like teaching somebody to play cricket, and I'm a cricket fan. And the test match is on today. Very exciting. So, so the first thing, now, how do you play cricket? Well, there are the rules of the game that you have to learn, and there are the tools of the trade. There's the bat, there's the ground, there's the ball. But every person plays cricket differently. Everyone has their own style. And if you're an aficionado, you immediately recognize who the players are from the different styles they play, from their different skills. And it is exactly the same with getting well from chronic fatigue syndrome and ME. Now, I can give people the roadmap. I can give them the rules of the game. I can give them the tools of the trade, but they actually have to go and manage it themselves. And in the early days, especially when things are difficult, and these interventions, can make you worse. They can make you worse with what I call DDD reactions, diet reactions, detox reactions, die-off reactions. That muddies the clinical waters. So sometimes it's not obvious, where you're at and where you're going. And that is made a million times worse with symptom suppressing medication. So, and this is one of the problems with conventional medicine. If you have somebody who is ill with lots of symptoms, what you should be doing is asking the question, why? Why have they got a headache? Why have they got tummy pains? Why are they bloating? But the doctors don't do that anymore. They give you a painkiller for the headache. They give you an SSRI for low mood. They give you a statin for the high cholesterol. They are not treating root causes. And to use drugs in that way is like, a detective coming onto a crime scene. It's all been messed up by people trampling all over it. The clues have gone. So drugs are part of the addictive picture of prescription drugs just as much as sugar, carbohydrates, alcohol, smoking, or whatever. So that all has to be taken into account. But the basic, the starting point is to use the symptoms as signposts. Now, again, symptoms are uncomfortable, but they're very important. Symptoms tell us that something is going wrong. And the symptom of fatigue is a vital symptom because we have so much energy to spend in a day. Let's pretend that it's that much. Now, if we spend more energy than we have available, then you will die. Because if you don't have the energy for the heart to work, it will stop. For the brain to work, it will stop, and so on. So the body and the brain cannot permit you to get into a situation of negative energy balance when you are spending more than you've got, because that's it, the lights go out. And the way to achieve that is by giving you symptoms. And those symptoms are so nasty, they stop you doing things, and that saves energy. So they give you physical symptoms, physical fatigue, poor stamina, aching muscles, light intolerance, noise intolerance, heart problems, the heart goes slow, low blood pressure, fast, all these symptoms it gives you, which make you feel terrible and stop you spending energy. Equally, it gives symptoms to the brain to stop it spending energy. Foggy brain, can't think clearly, can't multitask, poor short-term memory, procrastination. All these symptoms stop the brain from spending energy. So we have to ask the question, why? And the first thing we have to say is make the energy bucket bigger. Now, a very useful analogy that I use all the time is the car analogy. Sorry, Mary, you all know this inside out, so I apologise. I'm teaching my grandmother to suck eggs. But this is how I talk to my patients all the time. And they get it. And guess what? Even I can get it. And there are 4 important players with respect to making the energy bucket bigger, improving energy delivery mechanism. And for your car to go, you've got to have the right fuel in the tank. And that's all about diet, micronutrients, and gut function. You've got to have a mitochondrial engine. If the engine doesn't work, you're not going to make energy, and that's my special area of interest. And the engine takes fuel from the bloodstream, it takes oxygen from the bloodstream and burns that to make the energy molecule ATP. And then we have the control mechanisms. We have the thyroid accelerator pedal and the adrenal gearbox. And the thyroid accelerator pedal, that determines how fast mitochondria go. And the adrenal gearbox allows us to gear up in response to demand. So, if a saber-toothed tiger jumps out at our primitive woman trotting through the jungle, she needs every bit of energy can possibly summon, as generated by adrenaline, to run the fastest mile she's ever run in her life and thereby escape becoming breakfast. So the adrenal gland gears up. And again, there's another side to that, because if we don't need to spend energy, then we need to gear down and spend less energy, because that saves food. And primitive man, his survival would have been largely determined by food supply. So we can't afford to spend energy wastefully. And the adrenal gland allows us to exactly match energy delivery to energy demands, so nothing is wasted. So that's the overall strategy. And what I'm also becoming very aware of these days is that things have to be done in the right order. Now, when I first started treating patients with chronic fatigue syndrome, actually, when I first started, I really didn't know what I was doing. I was just kind of throwing things at random at patients, just hoping that something worked. But now I have a much better idea of the overall pan. Again, I'm quite sure I don't know the whole elephant, but I'm beginning to recognise a bit more of it. Things have to be done. And in the old days, I used to give people shopping lists of things to do. And I'm sure you've seen the same thing. Guess what happens? They cherry pick the easy things.
Yes.
Oh, it's easy to take a few supplements. I'll do that. Oh, it's easy to, I'll do that.
Yes.
But the most important thing, and perhaps the most difficult thing, is the diet. Because, repairing food, sorting out what you're going to eat, changing the habits for a lifetime takes a lot of mental, physical, and emotional energy. But if you don't start with the diet, nothing else is going to fall into place. Because if you don't put the right fuel in that tank, those mitochondria are never going to work well. And the amazing is we can muddle on remarkably well for some people, for some decades, running our bodies on sugars and carbohydrates. But it doesn't work in the long term. In the long term, we know that sugars and carbohydrates are a major risk factor for premature death. Obesity, diabetes, dementia, and dementia is now being called type 3 diabetes. Cancer cells can only run on sugars and carbohydrates, and heart disease. Sugar is sticky stuff. Sticks onto arteries, blocks them up, causes heart disease. So in the short term, sugars and carbohydrates may seem like rocket fuel, but they are disastrous in the long term. All those diseases and fatigue. So the first thing you have to do is change the fuel that our engine is running on. And that means swapping to a ketogenic diet. I.e., we get our fuel not from sugars and starches, we get our fuel from fat and from fiber. They are the perfect fuels. The protein content of the diet is exactly the same. The fiber, we need a high fiber diet, and we need to make sure we're eating plenty of calories. But the difficult bit is getting into ketosis, and that's the bit that everybody struggles with. And you know, I find myself, and I'm sure you are the same, Mary, I find myself talking more about diet than all other subjects put together. You know, the questions that pour into me by the email are, you know, what about this? What about that? Can I eat this? Can I eat that? And again, you have to work it out yourself. I've produced a book called the PK Cookbook that gives you some clues, but a very, very helpful tool is to actually measure your ketones to make sure you're in ketosis.
Yes.
Now, there are three ways you can measure ketones. You can measure ketones in the blood, that's beta-hydroxybutyric acid, but the trouble is you have to prick your finger to get some blood. The test strips cost £1 each, and guess what? I'm mean and I'm a wimp. I don't like doing that, so I'm not going to be testing my blood for ketones. You can test your urine for ketones, and that's very easy. It's very cheap. You can get the keto sticks, you know, on my website, and you pee onto them. A little pink patch should go a sort of purple color. You're in ketosis. But with time, the body gets better at matching energy delivery to energy demand. Because, of course, if you're peeing out ketones, you're peeing out energy. And that's not a good thing. And primitive man does not want to be wasting energy in that respect. So with time, the urine sticks become less predictive. And you can be in ketosis, and maybe that doesn't show on the urine stick. So I tend to recommend these days people use a breath test. Now, although that costs 45 quid to start off with, you can blow into it at any time. It's a very quick, easy, effective, painless, cheap way of making sure you're in ketosis. So now, if somebody comes to me and says, you know, I think I'm in ketosis because I'm eating, and they start to detail all the foods that they're eating, what they're not eating, I say, stop there, measure it. Yes. So this has made managing the diet so much easier and so much less time consuming. And what I found when I started using it regularly is I can actually get away with more foods than I thought I could.
It's shocking, isn't it?
Well, it's fine. And of course, you know, sugar is an essential molecule in the body. It is an essential molecule because from a 6-carbon sugar, via the pentose phosphate shunt, we can make a 5-carbon sugar, and that is the raw material to make DNA, make RNA, make ATP, and also helpful for detoxing. So sugar in the body is an essential molecule, and so much so that the body can make its own sugar from protein. It's called gluconeogenesis. So in primitive man, was just eating a pure meat diet, a pure carnivore diet, he could generate his own sugar. And for some people, a carnivore diet is a very good starting point to treat them. So sugar is useful, and obviously the body, if you can get it from the diet, it will do that because that's a metabolically cheaper way of getting that sugar molecule to do all the jobs that the sugar molecule needs to do. But because sugar is so addictive, and believe you me, I am a sugar addict. I think most people are sugar addicts, and the only way I can deal with it is by not having any of it. Because if I have one little bit, I want more and more and more. And if you are of that ilk, if you are the sort of person that if they have one square of chocolate, the whole bar's got to go, then you've got to find a different sort of chocolate. And what I have found for myself, and many people like it, with the 85% chocolate, I can have a square and I don't want any more. That satisfies me, that does it for me. But if I have the 70% chocolate, that's enough to switch on craving. So everybody finds out what their own balance is. And if it means you can't stop eating it, then you're in trouble.
Yes, that's a good policy. Just keep it out of the house if you can't stop eating it. Yes, I found the same. As long as I keep it below a certain threshold, I have zero desire. for other foods. But if you creep over that, then everything becomes difficult. You want everything, you think about food, and you never really know where that is. So I always just keep it nice and tight.
I get that. I mean, and I have to say, I'm not a paragon of virtue. If you cheat on the diet occasionally, it doesn't matter. I think it does very little harm, because we do have mechanisms for mopping up excess sugar. It's called glycogen. Yes. And so, if once a week, I mean, at the moment, of course, it's autumn. I'm a keen gardener, and I've got plums galore, I've got raspberries galore, I've got loads of fruit. And okay, if I overeat that and knock myself out of ketosis for a while, it doesn't matter, so long because I'm back on the bandwagon the next day.
Yes.
It's this constant, unremitting carbohydrates pouring in with bread, pasta, crisps, sweets, sugar, potato, chocolate, all that stuff. When it's unremitting, that's when it becomes pathological. So the body is perfectly capable of mopping up with some sugar, but the key is not so much that you knock yourself out of ketosis, and not so much do you start eating things addictively. Yes. So those are another two little keys to health matters.
There's something interesting I've seen, because now I've been in, for the most part, ketosis about 15 years. I go out sometimes with different tribes, or if I'm trying a diet, those kind of things. But the longer I've been in it, the more I can get away with. And you can really see that metabolic flexibility develop as you get healthier and healthier, to where I can actually eat an enormous amount of carbs in an evening and still be in deep ketosis the next day, which was not the case 6 years ago.
Fantastic. What that means is you have, as you rightly point out, we call it metabolic flexibility. You can deal with that, and and guess what? I can do the same too. So that's why it's very difficult for carb addicts in the early stages, because they don't have that metabolic flexibility. They don't have that ability to deal with a sugar spike, and they don't run efficiently on ketones. So there's no question it is difficult in the early days. It's got names. It's called keto flu, or metabolic inflexibility, or whatever. It's got lots of different names, but it gets, that's a very useful point to tell people. It gets easier as you go along.
Yes. So hard in the beginning, but it genuinely does get easier.
Okay, so the first thing that my patients have to do is a ketogenic diet. Now, that has another very profound benefit, because people who are running on sugars and carbohydrates, eventually they overwhelm the ability of their gut to deal with it. And that means that the upper gut, which should be an acidic, sterile, digesting gut to allow it to deal with fat and protein, suddenly becomes a fermenting gut. And the upper fermenting gut is a major driver of pathology. It's incredibly common. Symptoms of upper fermenting gut include reflux, heartburn, bloating, indigestion, feeling full after meals, and another interesting part of it is you often get central obesity. You become apple-shaped. So it's very easy to diagnose people who've got upper fermenting gut because they're apple-shaped. They have no waste. An even easier way to diagnose is to look in their shopping basket and see what they're eating. That's easy too. But that is a very bad state of affairs, because the upper sterile, acidic digesting gut is a vital part of being well. 90% of infection comes in through the mouth, either because we swallow it or because we inhale it, stuck on sticky mucus, and is then swallowed. Now, those bacteria, those yeast, those viruses should drop into an acid bath of the stomach and be killed. If you are fermenting, you no longer have an acid bath of the stomach. Those microbes are not killed. So fermenting gut and sugars and carbohydrates greatly increase our risk of infection. And many viruses, like Epstein-Barr virus, are enteroviruses. They come in through the gut. Polio is an enterovirus. It comes in through the gut. Second point is you need an acid stomach to digest protein. Funnily enough, I was just seeing a lady yesterday. She bought me an oat test, and we looked at her amino acids, and she had got no amino acids. She just was not, they were non-detectable in her urine. She just was not digesting protein properly. Why? Because she had a hypochondria, because she had an upper fermenting gut. So you cannot digest protein for the business of healing, repair without a good acid stomach. You need an acid stomach to absorb minerals. Again, when I do, in fact, these days I rarely do nutritional tests because I know what the answers are going to be. But you need an acid stomach to absorb minerals. So if you're fermenting, you're malabsorbing magnesium, zinc, selenium, copper, chromium, the whole shebang. And these are all essential for normal human metabolism. So, and the other problem, of course, is if you've got a gut that's full of these fermenters, these are not evolutionarily correct bacteria and yeast. They're not meant to be there. The immune system isn't used to them. Now, at medical school, we are taught, yes, the gut is full of bacteria and yeast, and there they stay. Not true. We now know that these bacteria and yeast get into the bloodstream quite easily. It's called bacterial translocation, fungal translocation. And in the bloodstream, they get stuck at distal sites. And the immune system comes along and says, oh, what are these bugs doing here? We better start fighting them. And it switches on inflammation. And inflammation in the muscles is called fibromyalgia. Inflammation in the joints is called arthritis. Inflammation in the skin is called eczema or psoriasis or urticaria, and on it goes. And there are many pathologies, which I'm quite sure are driven by allergy to microbes from the fermenting gut. And then, of course, what happens when they ferment? They ferment to produce nasty toxins like alcohol, D-lactate, hydrogen sulfide, ammonia, and these poisonous. Now, the liver does a fantastic job to mop up those toxins to stop them becoming too awful. But that requires energy. So, and again, at rest, the liver uses more energy than the heart and the brain put together. And the liver will always use the energy first because, that's a vital part of staying alive. If you took the contents of the portal vein, which is how the blood gets from the gut to the liver, if you took the contents of the portal vein and you put it into the systemic circulation, you'd go unconscious very quickly. That's, of course, what happens in liver failure. You go unconscious because the liver doesn't work. So simply the business of cleaning up the upper fermenting gut by starving out those microbes means the liver has to do less work, and therefore you have more energy to spend on yourself. So the PK diet is essential for that reason. And so the second intervention I'd like people to put in place is vitamin C to bowel tolerance. Vitamin C contact kills all microbes. So if you're starving little wretches out with the keto diet, and then you kill them with vitamin C to bowel tolerance, and I recommend start off with 5 grams a day, put them in your water bottle, little and often throughout the day. You then start to reduce the toxic load, the microbial load that the liver is dealing with. And you start to be able to absorb. And at that point, then you can bring in micronutrients, vitamins, minerals, mitochondrial support, and so on. And I see so many people who have spent a fortune on lots of vitamins and minerals. They're not doing the diet. They've got a fermenting gut, and they're just feeding the fermenters. Because bacteria and yeast in the upper gut, they are as hungry for CoQ10, for magnesium, for essential fatty acids as we are. It's a jolly expensive meal for them. And, you feed them well and they will ferment even harder. That's why there's a certain order about doing things. PK diet, vitamin C to bowel tolerance, then you can put in place the micronutrients. So at this point, we can then start looking at mitochondria, which, as aforementioned, are the engines of our car. Now, I worked for many, many years, early 1990s, with a wonderful biochemist, Dr. John McCarran Howard. And he developed, after some years, tests of mitochondrial function. And these have been fantastically useful tests. So in the noughties, about 2005, these tests became available. And at that point, I had a whole bunch of patients with fatigue syndromes who'd done the diet. I'd done my best with the supplements, looked at the thyroid and adrenal stuff, and they were still sick. And I was asking myself the question, well, why should that be? Now, at medical school, we learn that all about mitochondria. It's a difficult bit of passing the biochemistry exam. We mug it up the night before, splurge it out onto the paper, and then forget it the next day. Mitochondria didn't appear to have any clinical application, so we just forgot about them. So I started thinking mitochondria day, thinking mitochondrial function again, and said to John, can you do a test for mitochondrial function? And he developed this wonderful test. And I've now done 1,036 of those tests. So I've got a pretty good idea of how to interpret them and what they mean. But more importantly, this early group of patients with whom I was stuck, we looked at their mitochondrial function and we graphed that against their level of disability. And what was so fascinating is there's a direct correlation. Those patients who are the most fatigued have the worst mitochondrial function. Those patients who are the least fatigued have the best mitochondrial function. It was a real eureka moment. The third paper we published was all about, well, what happens when you give these patients the necessary regimes to improve their mitochondria? And we had 38 patients that we followed up. 36 of them had done the regimes, and then 4, for whatever reason, had chosen not to. And again, what was so fascinating is every single 36 patients, I mean, the statistics, we couldn't believe it. Every single one of them, they improved their mitochondrial function. And those 4 that didn't do the regimes, they all got worse. The important thing that arises from those studies is that you don't have to have the tests to get well. We now know what the regimes are to correct your mitochondria. And if you just follow the regimes through in the books, then your mitochondria will recover. So that begs the question, well, why do mitochondria go slow? And they can go slow for a number of reasons. They can go slow because you've not got the right fuel in the tank. Well, we've done that already. We've done the ketogenic diet, haven't we? So we've got the fuel in the tank. Then they can go slow because they are deficient in the raw materials that mitochondria need to run. And again, we measure the levels of things like CoQ10, magnesium, acetyl L-carnitine. And in my books, all the regimes of what you need, and it's on the website. So in order of importance, you need magnesium, 300 milligrams, plus vitamin D, 10,000 IU. Without vitamin D, you can't absorb the magnesium. You need CoQ10, 100 milligrams. You need niacinamide, vitamin B3, 1,500 milligrams. Acetyl L-carnitine is particularly important for the vegetarians and the vegans because they can't, acetyl L-carnitine is a 3-peptide polypeptide which comes from meat. So the vegetarians in particular need maybe a gram of carnitine, and then maybe D-ribose as a rescue remedy. So that's the mitochondrial package. Then mitochondria can go slow because they're blocked by something. Now, you often get clues here from the history. And of course, you don't treat any patient without taking a good history. Were you out in the Gulf War? Are you an aerotoxic pilot, or do you do an air hostesses, for example? They get poisoned by fumes. Exposed to fires, firemen often have poisoned by toxic fumes from burning plastics, all that sort of stuff. And that gives us clues as to whether they're poisoned and whether to do T-top regimes. So putting those things together gives us a pretty good idea. This gives us a pretty good clue that the mitochondria are getting better. And then the next thing we have to do is look at the control mechanism. Now, again, this emphasizes the importance of doing things in the correct order, because thyroid hormones and adrenal hormones, they manifest through their effects on mitochondria. So if mitochondria are not in a fit state to respond, you won't get the benefit from the thyroid hormones and the adrenal hormones. And at this point, then yes, tests are useful, but not definitive. So looking at the thyroid accelerator pedal, the biggest problem here is that the doctors think that you can diagnose hypothyroidism simply from a blood test. And that's how they try to diagnose it, and that's how they treat it. And what that means is that they are missing hundreds of thousands of patients who could benefit from thyroid hormones. So yes, you need to do the blood test to make sure the patient is not thyrotoxic and that there is biochemical scope for a trial of thyroid hormones. And then you have to ask about the clinical picture. Now, of course, as anybody who's hypothyroid will have a chronic fatigue syndrome, because your car, instead of going 50 miles an hour, is going at 5 miles an hour. And that's how we define chronic fatigue, or ME. So yes, there will be fatigue, but there are some symptoms that are peculiar to the thyroid. Slow pulse. If the pulse is 50 or 60 beats per minute, that's typical of underactive thyroid. Loss of hair, thin hair, lost the outer third of the eyebrows, again, typical of hypothyroidism. Being an owl. Thyroid hormones determine our circadian rhythm. And if you are somebody who can't drop off to sleep until 11 o'clock, 12 o'clock, 1 o'clock in the morning, and you don't start to wake up until 8 o'clock or 9 o'clock or 10 o'clock, then that's typical of hypothyroidism. Edema, being puffy, so voice changes, crease marks on the face when you wake up in the morning, puffy eyes, puffy ankles. If you look at your tongue, the tongue gets edematous. So you get a big tongue And if you look at the side of the tongue, along there, you can see teeth marks sometimes along the edge of the tongue. That suggests you've got tongue edema, people with hypothyroidism. And if you're ticking any of those boxes, then yes, a trial of thyroid hormones is incredibly helpful. And then again, one test which is very useful to look at adrenal function is an adrenal stress profile. Easy test to do. Anybody can do it. It can be done on a salivary sample, and that gives us a very good handle on adrenal function. So with those simple interventions in the right order, balancing things up, you can make a very good fist of energy delivery mechanisms. Again, all those things are mentioned in that simple, easy, cheap, read it in the evening book, and that makes your energy bucket as large as you possibly can. Now, those people who just have a small energy bucket and just have symptoms of fatigue, they are the patients we call chronic fatigue syndrome. If you've also got symptoms of inflammation, like fibromyalgia, flu-like symptoms, malaise, lymph node swelling, inflammatory symptoms, they're the ones where the immune system is busy and they've got chronic inflammation. And we call those patients ME. So ME is chronic fatigue syndrome plus inflammation. Now, some patients, obviously, you'll get well by getting their energy bucket as large as you possibly can. But some you'll be left with the ME side. I'm talking far too much. Do you want me to stop? And
this is fantastic. I'm loving everything you're saying. Yes, go on. Tell us about ME.
So let's look at the inflammatory component.
Yes.
And again, the history here is incredibly helpful. And if you have somebody who's tooting along quite well, doing well, and then they get a viral infection and they completely crash, then those patients are going to have ME. And guess what? We're seeing epidemics of ME at the moment. And what are we calling it? Long COVID. Suddenly, ME and long COVID, we're allowed to talk about those things.
Right. It's not taboo anymore. Yes. Yes.
Suddenly they become recognizable clinical pictures. So let's talk about long COVID because that's topical. That's what everybody's talking about at the moment. And long COVID is common. It's reckoned that about 10% of everybody who gets clinical COVID, now that's not the same as biochemical, I've got a positive test for COVID, because A, we don't trust the tests, and B, you can have a positive test for COVID and be completely well. You don't know you've had it. So what I mean is clinical COVID. People have been sick, flu-like symptoms, maybe a trip to the doctor, maybe a trip to the hospital, whatever. What we know is 10% of those patients will still have their symptoms 12 weeks on, and that's called long COVID. So the first question we have to ask ourselves is, why is it that some people get COVID and don't know they've had it, like you and me? And why is it that some people get COVID and they're really sick and they go to hospital and they go to ITU and they die? And the answer is, it's the immune system. Now, if you've got a cracking good immune system, you will pick up COVID. We will all going to get infected with it eventually. You'll pick up COVID, you'll get rid of it, and you won't know you've had it. And it's the same with long COVID. Why is it that some people get long COVID, after acute COVID, i.e. 10%, but 90% don't? And the answer is, it's the immune system. So the first thing we have to do is we have to improve immune function. And how do you improve immune function? Well, the first thing you do is you give the immune system some energy to fight with. So all the things we've just talked about, the diet, the PK diet, the mitochondrial engine, the thyroid accelerator beta, the adrenal gearbox, all those things will greatly enhance immune function because the immune system has suddenly got energy to run with. So that's number one. Second thing is the immune system needs some tools to fight with. And if you handicap your immune system, then it's not going to function well. And what are those important tools? Now, there are 3 tools that I use specifically for acute and chronic infections all the time. And they work so fantastically well that if used properly, you probably don't need any other tools. Now, the first tool is vitamin C. Vitamin C is one of my favorite tools. It's a multitasking tool. Anybody can get hold of it. It's dirt cheap. The potential for harm is 0. and it does lots of jolly good things. So the first thing it does, it contact kills all microbes. So, we start off using it for fermenting gut, but it also helps the immune system fight systemic infection. So the first thing we do with vitamin C is we take it to bowel tolerance. Now, this means everybody's dose is going to be different. Most people can tolerate 5 grams easily. That's 5,000 milligrams. You can't get it from food. You have to buy it and you have to add it to your drinks. And now I can hear everybody saying, well, why doesn't the whole animal world, take vitamin C to bowel tolerance? And the answer is they don't need to, because they can make it themselves.
That's right.
Dog Nancy doesn't need vitamin C. If she can manufacture all the vitamin C she needs from sugars, you can get the sugars from protein. So can goats, so can horses, so can all animals except humans, fruit bats, and guinea pigs. We are the only 3 mammals that can't make our own vitamin C. Now, thankfully, we're clever. We can synthesize it. So let's use our brains, let's use our intelligence to take advantage of this fabulously useful tool. So get yourself a water bottle, put 5 grams of vitamin C in, and gradually increase the dose. 6 grams, 10 grams, 15 grams, 30 grams, until you get to bowel tolerance. Now, what is bowel tolerance? If you swallow vitamin C, the body will take what it needs from the gut. It'll take what it needs for the purpose of fighting chronic Epstein-Barr virus, for detoxing heavy metals, for improving antioxidant status, for healing, repair connective tissue, or whatever. The vitamin C it doesn't need, it will leave in the gut. So that vitamin C starts to go down the gut, and of course the upper gut should be sterile and will be further sterilized by the presence of vitamin C until it gets to the large bowel. And if you get a certain amount of vitamin C in the large bowel, it will start to kill off some of the friendly microbes in the large bowel. And those friendly dead microbes will then start to get fermented by other microbes downstream. And that will give you wind, foul smelling wind, maybe a rumbly stomach, maybe a bit bloated, maybe a bit of discomfort. You'll know, oh, I'm getting to the edge of my vitamin C. If you take even more vitamin C, you'll get diarrhea. So you'll quickly work out what is your bowel tolerance dose of vitamin C, either that dose of vitamin C you can take, which gives you no gut symptoms whatsoever, and you feel in tip-top shape. So vitamin C for bowel tolerance is a fabulously useful tool. Next thing, vitamin D. Vitamin D is so important. Of course, the best source of vitamin D is sunshine. If you can get out there and sunbathe, the ultraviolet rays, penetrating your skin and getting into your blood, that will kill virus directly. That will kill bacteria directly. How do we know this? Work done in the 1900s, where light was used to treat skin tuberculosis. And the guy who developed that, his name won't come into my head, won the Nobel Prize for that discovery. So light is a very good tool for killing infections. Of course, you've got some nice light there in Greece, but we get the occasional sunny day here in Wales. But vitamin D is all part of the light story. And vitamin D, 10,000 IU, is highly protective against the complications of COVID. Why? Because it helps the immune system resist COVID, but most importantly, what kills people from COVID is not the virus. What kills people with COVID is the cytokine storm, that abnormal overreaction that the immune system throws in. And vitamin D is a very, very important immune modulator. It stops that cytokine storm. And this explains why Black and Asian people are particularly susceptible to COVID-19 and particularly susceptible to cytokine storms, because they can't make vitamin D efficiently from sunshine because they've got dark skins. They need a lot more sunshine to make that vitamin D than us, paler varieties do. So vitamin D, explains the disparity very nicely, not just of COVID-19, but of all other viral infections, influenza and other such. So vitamin D is very important. And the third incredible tool we have is iodine. Now, iodine,
that's great.
Iodine, like vitamin C, contact kills all microbes. When you have an operation or surgery, why do you wake up with a yellow patch of paint over your skin? Because that's what the surgeons love using. And the surgeons put paint iodine on because that contact kills all microbes. Now, iodine works from the outside in, vitamin C works from the inside out. So it's, it's like, having a right fist and a left hammer blow. It's a pincer movement to kill the microbes. And I use iodine in two ways. First of all, sniffing iodine is a fantastic treatment for at the first hint of any respiratory symptom. So runny nose, sneeze, sore throat. And the two bits of equipment you need is you need some Lugol's iodine and a salt pipe. Now, the salt pipe is just a way of administering the iodine. It's been used for years for the treatment of asthma. Sniffing salt is a great treatment for asthma, but we can supercharge it with iodine. So Lugol's iodine, which is the medicinal form of iodine, 2 drops into the mouthpiece of the salt pipe like that, 1, 2. Give it a little shake and sniff it. So put the fingers and 4 thumbs over like that and then sniff the iodine. Now, if you can smell it, you've got a therapeutic dose. And sniffing like that, you can feel it going into the nose, into the sinuses, and it coats the lining of the throat, the trachea, and the lungs. It's a fabulous treatment for any respiratory infection, and indeed hay fever. And,
I was going to ask you about that. Is it also good for allergies?
Well, interestingly, yes. This isn't. I can find some references, but no convincing references. But I know this from my own experience because I carry iodine with me all the time. It's a wonderful first aid medicine. And I'm anaphylactic to wasp and bee stings. I had a major reaction as a child. But since then, I'd never been stung until 2 years ago, working in the garden, and wasp landed on my arm and stung me there. And I could see this lump coming up, and within a few seconds, it was the size of a grape, and then it was the size of a plum. I thought, oh God, here we go. But I thought, let's try the iodine. So I've got the iodine, and then I just painted onto my arm like that to give a nice, a yellow-brown stain of iodine there. And within seconds, the lump went down, the swelling went down, the itch went, the pain went, and within a few minutes, there was nothing to show. I could just see a little hole where the bee sting was, and it didn't progress to anaphylaxis. Now, I have lots of patients who get bad reactions to horsefly bites, mosquito bites, and nettle stings. Iodine gets rid of it like that. It's absolutely brilliant. So, if you're a gardener or if you're a walker, make sure you've always got iodine with you. And again, if you cut yourself, it instantly kills any infections there. And that's actually another good reason to carry iodine, because as you know, we're seeing epidemics of Lyme disease.
Yes.
Lyme
numbers each year. Yes.
In America, we are seeing 1,000 new cases of Lyme disease every day. It's increasing at the rate of about 350,000 cases a year. And we know it's passed on by ticks, tick bites, that carries the microbe, but it is theoretically possible that it could be carried by other biting insects. We don't know, but don't wait to find out. Take the iodine with you. If ever you get bitten or stung, lapse on the iodine, and you never know, you may prevent yourself picking up some nasty infectious disease.
Definitely.
Iodine really important. Oh, and just as an illustration of how well this works, I've now got 4 patients with bronchiectasis. Now, bronchiectasis is chronic lung infection. They go from one course of antibiotics and they're well for a bit, another course of antibiotics, and they're well for a bit, and on they go until eventually they get an MRSA, they get a chronic infection, and then they are in real trouble. All 4 patients, and one of them I'm off on a riding holiday with on Sunday, all these 4 patients, by dint of doing the keto diet, taking vitamin C to bowel tolerance, looking after their mitochondria, and sniffing iodine, their need for antibiotics has now dropped to 0.
Amazing.
It's mind-blowing. It's not just amazing, it's mind-blowing. One of them is a GP down in the south of England who attends the Brompton Hospital, and they're blown away by it. They can't believe what's going on. But, do they recommend that to all their patients? No, they don't.
No. You know what was done? I don't know if you saw when COVID was first spreading. I was in Zimbabwe for about 6 months while it was first spreading. And sometime during the first few months, the president of Jordan, the country of Jordan, released instructions for the people of Jordan to go on the ketogenic diet, because there were these studies showing the antiviral state. And so so it certainly wasn't saying, you'll be superhuman, but you'll be more likely to fight it off and for it not to be an issue.
Well, that reminds me of another story that one of my patients told me. Her great uncle was in South Africa at the time of the Spanish flu epidemic. Now that was 1918 to 1920. The Spanish flu, now that was a proper epidemic. That was estimated to kill between 50 and 100 million people worldwide, considerably more people than had been killed, during the First World War. And he was having these patients come to him, and he was painting their mouth and their throat with iodine. He was just giving them, swilling neat Lugol's iodine, on their throats. And his death rate was 0. Now, the death rate from Spanish flu was about 15%. 15% of people who got it died from it. And he reduced that to 0 just with iodine. So it shows how powerful these tools are: the vitamin C, the vitamin D, the iodine, the ketogenic diet. Why aren't we all doing it all the time? Well, you and I know the answer to that. Follow the money.
Yes.
Anyway, I've had lots of patients who come to me and they've been diagnosed with Lyme disease. They've had all the antibiotics and they're no better. And the reason they're no better is because with antimicrobials, you get a percentage kill, but you never get rid of every last microbe. It's up to the immune system to do that. So if you've got a rotten immune system that can't get rid of infections efficiently, it won't be able to get rid of those last few microbes. So as soon as you stop the antibiotics, the problem comes back again.
Yes.
So please use antimicrobials where applicable, but get everything in place first, everything else in place first, energy delivery mechanism, and all the vitamin C, vitamin D that we talked about, because that will give you the best possible chance of recovery.
I have so seen that to be true. I really find when someone comes in and they've been sick, say with Lyme for 30 years, usually they've been put through all these antimicrobials, but their immune system isn't strong enough. And if they're just given 3 to 6 months on maybe like a ketogenic, a GAPS diet, a gut rebuilding, intense immune system rebuilding protocol with lifestyles, then they go after it later.
Well, the point is they might not even need antibiotics.
So often they don't. Yeah, so often they don't. That's absolutely true. Yeah, so I think this approach of, I was talking to a long COVID patient yesterday, and she had already gone through all these different kind of antimicrobial protocols, because obviously when your immune system is depressed, other things are going to be going on as well. There's basically like a signal that goes out and attracts other viruses and other infections. And so all these other things are popping up, and they keep, treating one and then treating the other. And here's H. pylori, and here's this, and here's that. And I was explaining that you're going to get lost chasing all of these flies. You want to focus on your main things: rebuild your immune system, rebuild your nervous system, take care of your stress levels. Because when your immune system is strong, those infections aren't a problem.
Well, of course, and if our immune system has been dealing with all these viruses for hundreds of millions of years, and if it didn't do it well, we wouldn't be here. We'd all be dead. So the immune system is incredibly intelligent, incredibly adaptive, incredibly clever. We've just got to give it the energy and the raw materials to do its job.
Yes. Yeah. Totally agree. Totally agree. Well, I really hope that lots of long COVID people go your way, because you've got wonderful resources online. For anyone listening or watching, check out Dr. Sarah's website. I will link all the resources for you to go. She's got courses. You can do her live courses as well. She's got her books there and treatment protocols. She's very generous with her knowledge, and it's extensive. You have been in the field a long time. You worked with a lot of people, and it's very obvious too. Like I mentioned earlier, I was so impressed by your incredible compassion for patients and for some of the medical abuse that they go through while getting diagnosed and even after diagnosis sometimes. And I know you're working on that. Can you tell me a bit about that side?
Sometimes I'm ashamed to be a doctor, because, so many doctors, They just run their whole medicine on simple algorithms. And if that patient doesn't fit, their simple algorithm, then they just blame the patient. They tell the patient, oh, it's in the mind, you're depressed, you're a hypochondriac, whatever. And that is just so wrong. And if the patient doesn't perceive that you are understanding what's wrong with them, and I don't see that you're feeling their pain, but if they think you're not, singing from the same hymn sheet, then they're not going to do the things that you suggest. So you have to ally yourself with that patient. Say, look, we're on the same side. I don't know all the answers, but I know some of them. I don't know all the routes, but I've got a vague, are you working with them, not against them? And I've never known a patient tell me a lie. That's another important factor. And doctors think that patients exaggerate, or they're spinning them, untruths. Or I've never had that happen. All my patients have been devastatingly honest, and if they say something is there, then it's there. I remember when I was at medical school, and I did my pediatrics rotation, and a very wise pediatrician teaching, and he said, remember, the mother is always right. The mother always knows what's wrong with that child, and they're just coming to you for affirmation and the correct treatment. Always listen to the mother very carefully. And I remember thinking, that's not just mum, that applies to everybody. You listen very carefully to the patient, they tell you what's going on, and they tell you, what the clues are. The problem is it's time consuming. I can't listen to everybody that I would like to listen to, and I'm sure you're the same. But yeah, you've got to listen, you've got to be empathetic, you've got to be on side, you've got to understand. I mean, thankfully, I haven't had chronic fatigue syndrome, but often the best doctors are doctors who have had chronic fatigue syndrome themselves. And you've had a flavour of that, obviously, Mary. You've worked it out for yourself from first principle.
Yeah, no, I'm so grateful for what you're doing, because the patients go through such hell so often for so many years, and I'm hoping and with their families as well. I'm hoping that with long COVID and this becoming so common, that will really change, and people will see that these things are very real conditions, and that the patients are being very honest about what they're going through. And also they very often downplay because they're embarrassed, yeah. Well,
right. The very people who get chronic fatigue syndrome and ME are, the ones, the go-getters. They burn the candle at both ends. They're the type A personality. They won't stop and rest. They won't lie down and die. They won't sit and put their feet up in the evening and chill out. They're doing things all the time. And yes, of course, with that sort of personality, what gets you into ME and chronic fatigue don't help you get out of it. Some people have to have a personality transplant to really,
No, it's true. And the irony of it is that the patients are too sick to do anything about it. So I'm so grateful to you. You're really an angel for this whole movement, because you're doing what no one can do. So it's really great.
I'm sure I'm not, but it's very nice of you to say that.
Really, you really are. It means a lot to so many people. So I have a couple quick questions, just rapid fire, let's say. How long do you recommend, and I'm sure it varies, but how long do you recommend being ketogenic for someone who has mitochondrial dysfunction, chronic fatigue? Well, is it a lifetime thing? Is it a year? What do you think?
We should all be ketogenic for life. Yeah. I've just produced another book that's due out in a month called Green Mother. And it's all about the application of all these principles, ecological medicine, diet, supplements, to pregnancy, childbirth, and our babies. All our babies should be reared on ketogenic food. Why? Because that's what primitive man did.
Yes.
Yeah. This is the evolutionary correct diet. Mm-hmm. So, you should be ketogenic for life. Now, as I say, that doesn't mean you never feast. It doesn't mean you never go out and enjoy a glass of alcohol or a glass of wine or whatever. But it means for most of the time, you're on a ketogenic diet. Because, A, you want to get out of chronic fatigue and ME. That's the first thing. But B, you don't want to die of heart disease, cancer, or dementia. They're the big killers. And sugar and carbohydrates are a risk factor for all those three things. So it's ketogenic for life. Now, I know I'm not going to live forever, but if I survive to 100, then I'll at a high level then I'll settle for that.
Well, I'll tell you, when I go and visit with these different tribes, and obviously, you know, they eat different foods because they eat regionally, right? But the children are fed egg yolks, butter, yes, very high fat, liver, these kind of things. And when I test the members, I test their blood sugar and their ketones. Their blood sugar is fantastic, and they're in ketosis. So yeah, I would agree with the book you just wrote. I think that's really good. I think I can guess this answer, but I don't want to. I want to be sure. So often chronic fatigue patients are put on things like Provigil or modafinil, these kind of energy wakeful things. What's your recommendation?
It's symptom suppression. You know, that's the equivalent of caffeine or amphetamine. So yes, it gives you a little window of energy, but it does nothing for energy delivery mechanisms. And if you fire somebody up with, you know, a stimulating drug like amphetamine or caffeine, then there's payback time. Now, I do use caffeine for some of my patients, because if they very much lose their diurnal rhythm, then sometimes caffeine in the day to fire them up to get them going, and then they're a little bit more tired and maybe they sleep better. That can be helpful. But remember, caffeine has got very long half-life. You know, I love caffeine too, but I wouldn't have any after midday. Half-life is about 8 hours. You know, too much really will wreck your sleep. So caffeine in the morning is sometimes helpful to fire you up, but not on a regular basis.
Okay, great advice. And what about this catch-22 of body temperatures being low? So many people have in American speak, 97-degree temperature, so low by a degree or two. And so, you know, they're not going to be breaking down their food and those kind of things. What helps to get their body temperature up? Do you do like saunas? Do you do, what do you like to do?
Well, let's get back to first principles. You know, I like to use the car analogy. Now, for your car to work, you've got to have all those players in place. Mm-hmm. And once the car is running normally, then the heater comes on and the car is normally warm. It's exactly the same for those cold people. Those symptoms of cold are symptomatic of poor energy delivery mechanisms. So you treat that cold temperature by ketogenic diet, improving the mitochondria, getting up to speed with the thyroid and the adrenals, and the temperature should come up nicely. And in fact, that's another very useful way of monitoring the adequacy of thyroid hormones and adrenal hormones. Because once you've done the PK diet and the mitochondria, then your average core temperature is a reflection of thyroid function, and the degree to which it fluctuates is a reflection of adrenal function. And the thyroid support brings up the core temperature average, and the adrenal support reduces the wobbles. And this can sometimes give us a very useful clue, because if despite giving people reasonable doses of thyroid glandular and reasonable doses of adrenal glandular or pregnenolone or DHEA or whatever you choose to use, if the temperature is still fluctuating markedly, then that may be a pointer to the body's trying to run a fever to deal with a chronic infection. Because that is, of course, a mechanism the body can employ to deal with infection. And of course, it does with an acute infection. If you have an acute flu or shingles, you run a fever. Why? Because heat kills microbes. So what you're describing is a symptom, and you might be able to bring it up artificially with a hot bath, but some people don't feel at all well if you do that. You know, they don't tolerate heat at all well. So you need to bring core temperature up with improving energy delivery mechanisms.
Excellent. When you were speaking earlier about the thyroid, I was thinking about a patient from when I was first practicing about 10 years ago, who her whole life, she was in her early 50s, and her whole life she had all the symptoms of thyroid disease and kept going to the doctor and kept going. She had been an athlete, she was an ice skater, and then gained all this weight in her 20s, couldn't lose it. She was constipated, fatigued, no eyebrows, you know, dry skin, all the works, the whole works. And no one would listen to her until she was 52, and finally a man listened. Her blood work was normal, of course, right? But he sent her for a scan. He did an ultrasound of the thyroid, and what he found was the thyroid hormone wasn't getting to the thyroid, so it was just shriveled up. There was hardly any of it left. And so, yeah, I so agree. I think treating by symptoms is so often far more important, especially in this crowd, especially because so often this crowd, the blood work isn't where most of the problems are. It's in the nervous system, it's in the microbiome. And so they can have great blood work, but be bedbound.
Absolutely.
Yes. Okay, let's see if there's anything else. We went over thyroid, we went over a bit of lactic acid. Those in the lactic acid storm, what do you recommend to just bring it down as quickly as possible, or is it more of a waiting game?
Okay, well, lactic acid, that is what is produced when your mitochondria can't deal with energy demand. So your mitochondria work aerobically with oxygen. And that means from one molecule of acetate or a ketone or pyruvate, from one molecule of that, you can make 32 to 36 molecules of ATP. You can get a lot of energy from that one acetate molecule. Now, if mitochondria are pushing out as much energy as they can, but there's even more demand, i.e. the body's saying, no, I need more energy for this emergency, then it can switch into anaerobic metabolism. Now, that is metabolism without oxygen. That's how yeast metabolize. It's incredibly inefficient. From one molecule of acetate or pyruvate, you can only make 2 molecules of ATP. So that's, on one hand, you can make 36, on the other one, you can make 2. So it's incredibly inefficient. And as part of that, as you make your 2 molecules of ATP, you make 1 molecule of lactic acid. And lactic acid is very painful. It causes muscle pain, it causes chest pain, it causes foggy brain. It actually inhibits mitochondria as well. Now, if your energy demand suddenly ceases and your mitochondria are working fine, you can convert that lactic acid back to pyruvate. But that requires 6 molecules of ATP. So it's like borrowing money from a loan shark. You borrow 2 molecules of ATP, 200 pounds, but you then have to pay back 600 pounds. It's an incredibly inefficient way to function. Now, okay, I do see if you've got to escape from that saber-toothed tiger, if you've got to win that Olympic gold medal, it's worth getting into lactic acid metabolism to achieve that. But if you're doing that on an everyday basis routinely, that's hopeless with the energy equation. You just make things an awful lot worse. So that's why pacing activity is so important. It's dead boring. Believe you me, don't ask me. I would struggle to pace my activity. I admire you for taking a day off every week. I'm not sure I could do that, but you must do it. And if you're getting that lactic acid burn, you're overdoing things. You're living life on the edge. You're getting close to that cliff edge and risking disaster. So it's all about pacing until you can improve your energy delivery mechanisms, and then the pacing doesn't become so vital.
Amazing advice. Amazing. The best. Thank you so much, Dr. Sarah. I cannot thank you enough on behalf of all the people dealing with ME and CFS. Your body of work and your compassion and your generosity of knowledge is truly incredible. You've transformed the lives of thousands and thousands, and I'm so grateful to get to talk to you today. Yeah, no, it's my pleasure, for sure. Thank you so much. Everyone head to her website, get in her classes, buy all of her books. Really, you'll understand what's going on with you so much more. And if you understand, you won't feel crazy. You won't feel depressed. You won't feel lost. You'll feel very vindicated, understood, and you'll understand the science of why the methods she's suggesting are so necessary.